So speaking of the wheelchairs and the stretchers, we talked last week about, and I won't say the name, but we'll call it the system. One of those systems that they market themselves of. You can recline it like a stretcher, and then set it up like a chair. And I've talked about in some of my previous videos how about I think it was 2 years ago. We were in 2025, so it would have been 2023. One of our client providers contacted us. They contacted us and listed our help after they had been involved in an accident, and they thought everything was going to be fine until it was determined by the insurance company that the patient was in one of those systems. So, and all of a sudden now, once that was determined, the insurance company bailed. They weren't going to pay anything. They weren't going to settle anything, and they walked away. And our client provider ended up filing for bankruptcy and closing up shop. Basically, because the way the insurance company was able to walk away without obligation is because they're not in a stretcher or wheelchair. What is this? And so, even though these quote unquote systems now claim to be ADA compliant, they could still be exceptionally problematic, not only for insurance purposes in terms of if there's an accident, but also logistically, layouts with the vehicles.
We've seen all kinds of things appear. I'm going to jump a little bit ahead where we've seen people being transported on incorrect chairs, a chair, for example. Again, that was a shocker to me, only because I know it's not a safe way to transport somebody. And, we've also, in the state, as I mentioned last week, the state allows, some of these providers to transport patients on stretchers, and what they actually use are the ratchets that typically you would use on a wheelchair.
Yeah.
I question that. I say, hey, what is,
That's insane.
Is that illegal, or is that what the state mentioned was that the state allows it, and when I questioned them about the insurance, and the state, what they said was that it's between the provider and the insurance.